All right, good morning everybody. I'm here to provide an update on how the region is travelling with COVID-19. So some really good news. Over the weekend we saw very low case numbers of COVID-19, and I think what we're seeing is our community now really getting used to the new ways of living with COVID. Some good news in terms of our aged care facilities, and if we recall, down in Albury we had 3 aged care facilities where we had infections, and a really momentous day for those aged care facilities now, as the first one has welcomed visitors to that aged care facility where residents are now able to reconnect with their families and loved ones now they've completed their period of isolation. Albury is also stabilising. We're still seeing some case numbers in that region. And what we're now doing in terms of living with COVID is we've got a number of outbreaks that we're seeing across our region, largely seeding from other outbreaks. So down along the border with Victoria, along the Murray River, we've got some outbreaks there, obviously in the Federation area and across to Mulwala. Schools are also continuing to be impacted, as we saw when we had the first Albury outbreak, and we're seeing that now in Wagga Wagga as well. But what we are doing is, I guess our principals in the school systems have really learnt how to do their risk assessments and really minimising the number of children who are affected. Importantly for parents, it's a very challenging time, but the child in a classroom, if there is a case there, it's only the children that are identified as close contacts. Parents are not close contacts, but of course children who are close contacts will always need a caring parent, and so that then means that we have people going into isolation with their children. Fortunately, children tend not to get very, very sick with COVID-19. Nevertheless, we look after them in our paediatric community in the care pathway. It's overseen by our paediatricians. We are seeing some impact of parents who are unable to work, looking after their children who are close contacts at Wagga Base Hospital, and we are introducing rapid antigen testing there so that we can get people back to work after they've completed their time. In terms of vaccinations, there's some really fantastic and really brilliant vaccination rates for our region. 16 and over, 97.8% first dose and 93% second dose, which is really fantastic. The layer of protection that the vaccination is offering our region is really impacting on the case numbers. Still focusing though on children aged 12 to 15, where we've seen 83% of people have their first dose, and for children we're almost at 70% now of children who have completed their vaccination. Where we have vaccinated parents and those vaccinated teenagers, it does offer that additional protection to younger children in the family. So in terms of living with COVID, we're really seeing the younger population group as the majority of case numbers, and in particular primary school aged children, as at this point in time they remain largely unvaccinated. And we really are looking forward to the introduction of the vaccine, and we're looking forward to the TGA approval authority having a look at that for early next year. In terms of our hospitals, we've still got really low rates of people in our hospital admitted system, so we've got 5 patients currently admitted and receiving care in the hospital setting, and about 94 patients who are in our hospital in the home, where they're on remote home monitoring and they get calls from our nurses to check on how they're travelling. Just reminding people though that COVID is out and about in the community, and for people who contract COVID-19 and have to go through that 14 days isolation, it is a difficult time for people, not being able to go out, not being able to connect with family, and we really also provide that additional mental health and wellbeing support for people who had COVID-19. So in terms of cases today, we have got 13 cases reported up to 8 p.m. last night, 6 in the Albury LGA, 2 in Federation, 2 in Lachlan, 2 in the Wagga Wagga LGA, and 1 in Snowy Valleys. And an additional staff member at Corowa Hospital has tested positive over the weekend. that takes the total to 6 staff and 4 patients in the Corowa Hospital outbreak. So as we're learning to live with COVID and we start having more and more patients come into our hospital systems who could be possibly COVID-19, I just want to reassure the community that we've got very, very stringent processes in place. You'll see staff now wearing PPE a majority of the time in the emergency department setting. And really anybody at all with symptoms, we really screen people heavily when they come into EDs. And anybody who's got even the slightest symptom of COVID-19 will be treated as a suspected case and tested until we have confirmation otherwise. Also, patients undertaking surgery will currently require a COVID test, again, just to protect our hospital setting where we've got our most vulnerable patients. So I just want to reassure the community in Corowa, it is safe for you to go to the hospital. There's been fantastic testing results from the community in Federation, and we had 304 people came forward for testing at the back of the hospital there last week. So that's a really great number of people. Testing does remain high across our region. We had 14,500 people, just a sniff over that came forward for testing over the last 7 days. So just wrapping up, as we are now learning to live with COVID-19, and it's been so fantastic being able to get out and about, go shopping, go into restaurants, pubs, and connecting again with family. We're coming up for Christmas now. And we're also coming up for the time when people are eligible for their boosters. So anybody who had their second jab 6 months ago is now eligible for boosters, and we encourage people to make appointments either with their GPs or come into any of the clinics that are walk-in clinics. If we can get the majority of people with their boosters, and hopefully next year when we start to see the vaccination of children, that will continue to keep COVID at a low ebb in our communities. Thanks to absolutely everybody out there in the Murrumbidgee region. You have continued to be vigilant. You have listened to the different ways of living with COVID-19, and you've continued to come forward for testing. We are still seeing some people coming forward for their first jab, people who may have been hesitant and have been thinking it through. We had just in one of our clinics 75 people coming forward for their first vaccination last week. So if you haven't had your jab yet, there's still plenty of time, and we encourage you to come forward. So also we have a great opportunity today to meet our new superintendent for the Wagga region. Superintendent Andrew Spliet is here with me today, and I'm going to introduce him. We always do this chat together, Andrew, but there's a great opportunity for you to have a chat with our community now. Thank you.
Good on you. Thanks, Jill. As I was introduced, Superintendent Andrew Spliet is my name. I'm the new Superintendent for the Riverina Police District. Obviously our part here in this pandemic was to support health, which we continue to do, and we're there to assist as needed. I can advise that over the last 7 days we haven't had any adverse incidents that we've been called to. The community's generally complying with the requirements for the QR code, as well as showing the vaccination and so forth. So from just arriving here a week ago, I can say that from what I've seen, the community here around this area has done an excellent job, as outlined by Jill, in complying with what was needed to be done with the relevant health orders and so forth. And obviously we're running along fairly well at the moment. That's all I've got at the moment. Is there any questions for myself or Jill?
Thank you, Andrew, and welcome.
Thank you.
So just a quick question. We've heard rumours of an outbreak at, I think it's Alawa Lodge aged care in Coolaman. Can you confirm there is an aged care centre out there that has been recording cases, and I guess what's being done to protect people there?
So I'm not aware of an outbreak there. We'll have to take that one on notice and go and find out. Sometimes when COVID test results come through, it takes a while for them to get into the system and report it up, so we'll happy to look into that one. Sam can let you know.
Great. The other one was just, you mentioned that 14,000 tests have been done over the last 7 days. Is that high enough testing rates given the ongoing cases? And one question we had was, I mean, is the big drop in cases definitely a sign of, I guess, the protection in the community, or could it also be a sign of testing dropping off?
That's $1 million question, isn't it? And look, we really do need to encourage people to come forward for testing, because, as you say, if we have high testing rates, then we'll continue to pick up cases early and get them into isolation and keep the community transmission minimally. But I think people, particularly now, know that COVID is out and about, and it's been really probably in most LGAs across our region now, are very vigilant when they do get symptoms. And we've had people coming both into our EDs, but mainly into our testing centres when they're concerned and getting tested. So we just need to keep that momentum going and encourage people to get tested early. I think the worst thing that we can do is, if there are people there hesitant about going into isolation and possibly going to work and infecting the workplace, that's how we get much bigger outbreaks. And I'm sure that people don't want to be responsible for infecting their family and friends. The other surveillance thing that we have used over the last 12 months or so has been the sewage surveillance testing. And now really that COVID-19 cases are out in our community, and we've got people travelling from Melbourne and Sydney and all over, and you can possibly get people travelling through the region who have recovered from COVID. It still might have fragments in their body. That surveillance in the sewerage is becoming less reliable in terms of being an indicator. And we come and go, and we see it coming and going in communities where we don't have cases. So we're probably moving away from that in terms of surveillance. The other thing that's come into play has been rapid antigen testing. And rapid antigen testing has been proved to be really helpful for industry, particularly if you're bringing large numbers of people together, or there's been a COVID case in an industry setting. Getting staff, when they come to work, and doing that test every day for 2 weeks has been very, very valuable in keeping businesses running and operating, also whilst managing symptoms that might be, or risk that might be there to the workplace.
And so just to confirm, so 14,000 tests over 7 days, would you consider that high and enough testing rates?
Well, what we do is we have a look at the positivity rate out of the testing, and so at the moment the Murrumbidgee region has a positivity rate that's acceptable. We really don't want to see testing rates go down much further than they are now. And when we opened up our new drive-through, we saw again a real increase in testing for Wagga, 2,985 tests in Wagga that we did over the last week, which is a really good result. Yeah, Griffith 400, Corowa 300, even 162 in Mulwala. So we are seeing where we have risk in the communities, people coming forward and getting tested. So at this point in time, we don't have a risk with the positivity rate. Any other questions? All good. Okay, thank you guys.